Buenas tardes. Buenas tardes.
Good afternoon, everybody. Following the informal meeting of health ministers of the European Union, we're now going to have a press briefing. José Miñones is our Minister for Health in Spain, and Commissioner Kyriakides will give comments on what happened today. So we'll have the Minister speak first, then the Commissioner, and then we'll take a number of questions. Remember, the questions are restricted to the issues discussed during today's meeting. Please identify yourself before asking your question. The Minister of Health of Spain has the floor. Thank you, Manuel. Okay, well, good afternoon, everybody. As you know, we've just concluded our informal Health Ministers' Council of the European Union during the Spanish presidency of the Council of the European Union. I'd like to thank the city of Las Palmas and Gran Canaria, the Lady Mayor and others for all the hospitality you have given us during our stay here, allowing us to enjoy the city and ensuring that all our fellow ministers had a very pleasant time. Many thanks to all of your neighbours as well for the warm welcome and their cooperation. At the same time, I'd like to stress the very important work which has been done by the whole organizational team of the Spanish presidency of the Council of the EU. Now, in thanking people, I would like to thank the 39 delegations in all who participated in this meeting, all of the member states of the European Union, of course, and Norway and Switzerland were on board, as well as the WHO, the European Medicines Agency, and a number of other organizations who were represented. And, of course, we had Commissioner, dear Stella, thank you for coming here today and participating in this work with us. And thank you for what you have told us and your contributions and input as well. Your presence always guarantees a high quality of discussions and a high level of commitment to the thing which is important to all of us, the health of our population. Now, the image which Spain is projecting during its presidency has been very, very positive in the light of this diversity and plurality in our country. Having said that, I would just stress the most important outcomes of the meeting we had today. I would say that I'm very happy with the way the meeting has gone, stressing health as an important foundation for the well-being of any member state and its population. And we wanted to create a solid basis for the various health systems to ensure not just health and well-being for European citizens, but also to be able to do something very important in these times, the coordination necessary to face up to all of the various challenges we may be faced with. Now, the COVID-19 crisis, as you know, did leave us a lot to learn, a lot of lessons, and the important is unity of action. I think unity of action, a unified Europe without any fissures or that's important, I think, for all of us, men and women in the European Union. And most importantly of all, the construction of a European health union, which is not only a priority, but an important element of the unity we wish to display. So we did have a significant level of consensus during our meeting today, where our ministers committed to cooperate in moving towards the European Health Union based on a culture of prevention and ensuring health in the European Union, strengthening our healthcare systems and also promoting new strategies in existing pathologies in Europe. So a brief summary of each of the sessions we had today. First of all, we talked about digital health. We know that we're in a hyper-interconnected world where access to information is available at the click of a mouse to anybody, and this means that new technologies are important in the health area as well, in particular, to be able to deal with possibilities which any of us may be faced with in the future. We're looking at health from an integrated approach. In other words, it was clear this morning that the rights of citizens to have their health data available to them, a guarantee of quality and independent health care, with adequate protection of their data. These are all the objectives we were striving for. Now, the future of a genuine European health union must involve promoting research and innovation. We have been working in these areas as well, and there was also a consensus on the fact that we've got to make use of the opportunities which health data give us to push forward research and innovation and to ensure that this means better products and services and public policies in the health domain. As became clear during the input we heard this morning, protection of the rights of persons with regard to their health data was a key element to be taken into account in all of the systems which use or manipulate this type of information. So we've got to be able to ensure this level of trust among citizens when it comes to the ethical use of their data. The importance of managing and handling data was one of the issues we talked about in talking about digital health. Managing health data at a large scale will allow us to provide incentives for new products and services. And this is a key aspect of technical innovation, which is paving the way to make this possible. We've got to ensure that our citizens have the health care they need, irrespective of where they happen to be. The important thing is that the data travel, not the patient. So I'm very grateful for the awareness of the Commission in including digital health as one of the bases of the European Health Union. It's important to have a high-quality European Health Union in terms of data. We have the regulation on the European health data space as well coming up, so we had a lot of mention of that as well. This is an instrument which is going to ensure that European citizens will get quality health assistance in any EU member state, and digitalization is going to be a key lever in ensuring that national health systems are more robust, more agile, and more resilient. The second session talked about mental health. As you know, Spain has been a pioneering country when it comes to the policy agenda for mental health and working to remove the stigma surrounding this, surrounding mental health, mental illnesses and so on. We all agree that we've got to deal with this perception and the stigma with regard to mental illnesses, which obviously has been around for far too long. Now, once mental health has been put on the public agenda, well, member states agreed that we need to integrate mental health into all policy areas because of its importance in terms of socioeconomic, environmental, and indeed community factors. So it's got to be transversal. We've got to work on mental health together, work on education, and ensure prevention is important as well. In Spain, we have updated our mental health strategy back in 2021, which hadn't moved for many years before that. So this involves an action plan and specific projects which are currently underway. We need points of reference and guides for action as well to ensure that this homogeneous framework applies throughout the European Union. Here on this point, I would like to thank the Commission for the communication it tabled recently, and Commissioner Kyriakides shared that with us here in Madrid as well. That's a key milestone for the European Union. And it's important to prioritize mental health. It's a question of political will. Either we act or we're too late, basically. So the interventions made it clear that everybody shares the view that it's important to ensure the mental health of our population. We need to focus on young people and vulnerable segments of society as well, always from the point of view, the essential point of view of prevention. Then, finally, over lunch, we talked about open strategic autonomy, the OSA initiative. This has become a key concept for the EU, touching on many different areas: energy, food, and also, of course, health, all of which need to feed into this presidency strategy on OSA. We saw recently, of course, how the pandemic put our healthcare system's resilience to the test, but also we saw the need for improvements when it came to preparedness and our ability to respond to future health crises, access to and provision of medicines, for example. All member states agreed that it was important to generate mechanisms to ensure medicines and medicinal products are available in their region. And the Commission's strategy is very, very important because it involves guaranteeing diversified supply chains for medicines in particular, to be able to be sure that the EU can cover its needs. Here, the OSA initiative is a strategic reflection, basically, and we hope that all member states will work together on the basis of this first document with its recommendations, including issues such as the availability of APIS products. Now, the document has been transmitted to all member states as well, and our idea would be during the month of October then to be able to continue our debate during our presidency. So I will close by saying that I'm satisfied with today's meeting and today's debates and discussions and reflections. I think it will bring us forward towards our major objective for the health ministry during the Spanish presidency of the European Union to construct this European Health Union. I think we have a general consensus on the need to set out the shared bases for such a union. Having said that, I will now give the floor to the European Commissioner for Health, Stella Kyriakides, and then we will take any questions you may have. Commissioner.
Thank you. Good afternoon, ladies and gentlemen. First of all, I want to thank Minister Miñones and the Spanish presidency for organizing this council meeting today, and especially for welcoming us to Las Palmas. And I would like to take this opportunity to wish you and all your team a very successful presidency, particularly in taking forward our key health files. The meeting today was focused on, I would say, on an overarching theme of building a European Health Union. And I want to thank the Minister for this, and mostly thank him for sharing this belief that this is the direction that we need to go on, and this is a direction that we need to travel on because it will be benefiting all our citizens and all our patients. It's important to mention this fact because it highlights very clearly what has been over the last few years a paradigm shift, a change in the way that we view EU health policy since the beginning of the pandemic. And this is why together with the member states and of course with the European Parliament, we have put in place the foundational pieces of what is a strong European Health Union. And this will be a union that will make a difference for every citizen, not only today, but in the years to come. This includes having a reinforced health security framework, including HERA, and stronger health agencies. We've strengthened the mandates of ECDC and DMA. We have in place a tangible plan, which is already delivering, to fight cancer. And we had the files on the agenda today. And as the Minister said, we have the world pioneering European health data space, the EU pharmaceutical reform, which aims to create a single market for medicines, and our new comprehensive approach to mental health. So I think that together we have the opportunity to use the crisis of the pandemic and to change the face and the future of the health policy in Europe for the benefit of all Europeans. All of the topics that we discussed today are the building blocks, are part of the building blocks of a European Health Union. Now, let me just touch on them as the Minister has, just to highlight a few points. First of all, digital health. Now, digitalization is critical for healthcare, and it can make a real difference to citizens and, of course, to health systems. And what the COVID pandemic did was it highlighted the importance of electronic health data and digital tools like telemedicine. And this enabled us to have better patient care through those very difficult times that we all remember. We all know the EU Digital COVID Certificate. This was central to our pandemic response, and it helped us get our economies and our societies open and moving again. This has now become a global standard. It is now being used in, I think it's over 80 countries, and in fact now it is going to be used by WHO as a global framework for better digital health. And this is proof of its success that we have handed it over to WHO to now become a global standard. The European Health Data Space proposal aims exactly to bring the benefits of digital health to everyone in the EU, leaving no one behind. It's going to offer citizens greater access and control over their health data. It will enable doctors to comprehensively understand their patients' health, even across borders, so when citizens travel, and this will lead to better healthcare outcomes. And the European Health Data Space will also create a very strong legal framework to allow the researchers and industry and policymakers to use health data to accelerate the development of new treatments, of medical devices, of next-generation antibiotics. And importantly, it gives citizens access and control over their own health data. We will be including a path which is opening a future of the role of AI, of artificial intelligence in health, and we have already started working on this, and it links in with Europe's Beating Cancer Plan, for example, through the European Cancer Imaging Initiative, which will better be able to detect and address cancer. When it comes to a European Health Union, and we speak about health, we can not only be speaking about physical health. Physical health and mental health are one. Our health is both together. And this is why we speak about mental health, and we last month started for the first time a first step in having an EU comprehensive approach to mental health. This is the beginning. We all recognize that mental health issues and challenges are faced by millions of citizens, and we need to address these challenges. And we aim to address every aspect of mental health. And what I would like to send as a clear message to citizens, and I shared it with the ministers today, is that mental health, our mental health matters, and that we need to speak out, and we need to ask for help when we need it. And we need to share the message that it is okay not to be okay. And I think that this is the way that we will fight stigma and discrimination in mental health. We have put forward 20 flagship actions. I will not go into them, but they go for prevention, to early intervention, to quality of life, and we have over 1.2 billion euro of funding. And last month, and I want to say this, I came to Spain to present our new approach, and I was able to visit with the minister a center in Madrid, a telephone emergency center for those facing challenges, for those people who are facing difficult choices of themselves, with depression, with potential suicide. And I saw really the commitment and the passion of those people working in this telephone center 24/7. And I saw with what determination the Spanish presidency has put mental health at the top of its agenda, and I want to thank them. We have a conference on the 10th of October of Mental Health Day, and this will be an opportunity to discuss how we can turn more of these initiatives into actions. And last but not least, the topic we had today was on the strategic autonomy in the EU of medicines, and this is not something we're starting from scratch, and I want to stress this because the EU became the pharmacy of the world during the pandemic as a major producer of COVID vaccines, and this showed how we can work together for production and for innovation, serving all citizens. We had an EU vaccine strategy that delivered vaccines to every single citizen in the European Union on the same day, no matter where they lived. And that strength of the European vaccine strategy showed the strength of solidarity for the member states in the area of health, and that's how we need to work together. But we also saw the vulnerabilities in the supply chains, what we need to do to be stronger. And we need to reduce medicine shortages. We need to make sure that medical devices are available. And this is why we came forward with the pharmaceutical reform, which is the way forward into changing the way that we have access, affordable and available medicines for all patients and all citizens in the EU. We are creating the first union list of critical medicines, and we're creating the first EU alert system to monitor shortages. And we're open to reflecting on long-term measures through a Critical Medicines Act. So once again, I want to take the opportunity to thank the Minister. I want to wish you really the very best for the Spanish presidency. I look forward to having many important similar discussions and more with you, because I believe that we share a very common vision, and that's a vision of a European health union that will benefit the patients and, of course, all the citizens of Europe. So thank you very much.
Thank you very much, Commissioner. Thank you very much, Minister. Now the floor is open for journalists. Please introduce yourself, mentioning your name and your newspaper. Good afternoon, I'm Begonia Fernandez from AFE. I have a question. In this single medicines market which you're working on, are you going to be ensuring that people with rare diseases benefit? Because the medicines available in the EU for rare diseases often take a long time before they get to Spain. It often takes a long time before they get here, a year or 2 years, and it's difficult for funding to be approved. That takes a long time. And also when it comes to mental health, you said education and prevention are key. Could you tell us a bit, for young people, for example, given that the suicide rate's high, it's the second highest cause of death amongst young people in the EU, what can be done there? And third question, digital health. I don't know whether data were mentioned and the ethical side of things. And I don't know whether digital technology was mentioned in centres where primary health care is provided. Thank you. Okay, well, in response to your first question on rare diseases, there is this medicines law and the legislation on strategic medicines. Rare diseases will be covered there. We'll cover medicines for rare diseases. There are various mechanisms which exist. Through the national health system, we are putting into place measures not just to make medicine available, but also to cover treatment and information as well. That's obviously closely linked to digital health. We're looking at sharing information through healthcare professionals so that then the necessary treatment can be provided. When it comes to young people and mental health, well, yes, that is one of the issues we discussed. Various member states mentioned the need to act directly when it comes to new technologies, legislation, social networks. I think, as Commissioner Kyriakides said, there was this hotline as well. It's a 24/7 hotline. We've had it for a year. It's really bearing fruit, and we're learning from that. Obviously, it's important to work to help young people. We need targeted, concrete measures. And through the action plan which we have at national level, we are basically translating what we're planning on doing. Funds are there. Of course, that's key. We're focusing on funds to help with mental health issues. We basically transfer money directly to the autonomous regions so they can carry out activities and so they can also improve what exists. When it comes to digital health, we didn't just speak about equipment and technology, we spoke about data sharing as well, protection of data, how data is used for research and innovation in particular. But as you know, when it comes to improving healthcare centres and facilities, as you know, the government has the MINAB plan, which is aimed at improving infrastructure in healthcare centres. improving equipment, and also the high-tech equipment in hospitals as well. We have a plan for that as well. Yes. Stella, sorry.
Thank you. Yes, there are three very important questions. I just want to touch on them. First of all, on the issue to do with the pharmaceutical reform. You are absolutely right, because what we have so far is we have safe medicines in the EU, but we have not got a single market for medicines in the EU. And we know that there are citizens and patients with rare diseases in many member states who know that there is that there is an available treatment, and it may not access them for a very long time, if ever. And this is a situation that we wanted to change at the European level to then enable member states to be able to exactly implement their own policies. So what we are doing through the pharmaceutical reform, which is a reform that is coming, I think it's almost 19 years since this legislation had been reformed, is creating, won't go into detail, a system of incentives that companies will benefit from, which will ultimately help them work towards innovation, towards supply for the patients with rare diseases. And I think that this is an important part, that when one discusses the pharmaceutical reform, one needs to see it as a toolbox that will give really support innovation in the EU, but at the same time enable medicines to be distributed at the same time in all member states. In terms of mental health, and you mentioned young people, in our comprehensive approach that we presented, we look at what we need to do for young people, because we need to address vulnerable groups separately. Children, young people, adolescents, those who are displaced, the elderly. And there's a number of actions which member states can exchange best practices from, but also that we will be supporting in order to work on this. Because with mental health, you need to be able to have not only access to services, but also build on prevention and early intervention. And finally, for the digital health, the issue of privacy is an extremely fundamental one for us as a Commission. There will be lots of discussions, I'm sure, in Council and, of course, with the European Parliament, but I can assure you that what we are working on at no point compromises the issue of personal data and privacy, and we will continue to work in that direction. For citizens to use the European health data space, they have to feel confident that their data is being protected, and at no way are we going to compromise that at the Commission level. So thank you.
Pues muchas gracias a todos. Buenas tardes.
Thank you very much. That's it. Bye-bye.